Hey everybody, Dr. Mork here again. My friend Renata asked a really great question that's really hard to answer. She asked, how do you get somebody you love to go to therapy? There's this thing called anosognosia. It is a symptom of many mental illnesses, and it's a lack of awareness or lack of insight. Think about it. The part of the brain that has the disease is the part of the brain responsible for awareness or insight into the disease. And so many individuals with a mental illness lack the insight into the fact that they have a mental illness, or the severity anyway of it. So how do you get somebody to go in and seek help when they have anosognosia, for example? First, you can talk about the situation, but make it about you. Point out using I statements your concerns. You can say, I am worried, I have noticed, but make sure that you avoid using you statements. When you're talking about anger, for example, you can say these outbursts as opposed to your anger. Or when you're talking about a drinking problem, you can say this drinking habit as opposed to your drinking. Because what happens is when you use the you statements, it becomes very personal. The individual feels they're under attack, and it feels like it's a character or logical problem, when really it is a very discrete, separate issue from them. It is a behavior. It's this thing out here that is attacking our life right now. So use I statements, not you statements. You can talk about therapy or treatment as an experiment. You can ask them if they would consider maybe going in, trying it out for 4 sessions. That's it. Would you be willing to go for just a month? And then we'll revisit it at the end of the month. Another pretty great way of maybe talking about it is asking them if they would be willing to go in for an evaluation or an assessment, because that gives them a little bit more sense of control over the outcome. So just as I'll make a deal with you. I will stop harping on this if you agree to go in for an evaluation, and then at least that gets their foot in the door. Offer to go with them, offer to drive them, to sit with them in the waiting room. You can even offer to go in with them for that first session if that would help them be more comfortable. And then finally, because one of the symptoms of mental illness is often a loss of motivation, telling somebody they need therapy and then insisting that they find a therapist is really overwhelming. So you can do the research and then provide them a short list of 3 or 4 different therapists that might be a good fit for them, and then ask them which one do you think you might be willing to visit. And here is my last point. We have no control over anybody else's behavior. The only behavior we can control is our own. And so you can have this difficult conversation, and my hope is that it will be effective. But the reality is, if somebody you love is unwilling to go in to seek help, perhaps you would benefit from talking it through with your own counselor. Having your own counselor models really good behavior, really good mental hygiene, and also your counselor could possibly support you in your process. I hope you find this helpful. I don't intend this to be therapeutic, but I hope you find at least one piece of advice that can help you and your loved one. I'm Dr. Mork. Don't forget to laugh. I'll talk to you soon.